anyone wants is a vaccine. Can you please give us the best insight you can and sort of where you are as we're expecting some data from your phase 1 vaccine soon?
Sure, Alex. It's a pleasure to be here with you today. Since we've announced our lead candidate for the vaccine on March 30th, we've made great progress. So very shortly here in the next few weeks, we'll have our preclinical data published in a very prestigious scientific journal. But we have so much conviction and confidence based on that data that we're able to move into trials for humans starting next week, next Wednesday to be specific. It's going to be better than 1,000 people, ranging from the ages of 18 all the way to 65 and beyond, so the most vulnerable population. We'll also be studying it as a single dose regimen as well as a prime plus boost regimen. So some really good options there. We're also in discussions with the NIH to see if we can be possibly and responsibly begin our phase 3 data and trials at the end of September. So that would also be ahead of timelines, and that would measure, obviously, the vaccine's effectiveness. So we're working 24/7 to be part of the solution to address COVID-19.
Mr. Wolk, good morning. Guy Johnson in London. You're going to do it on a non-profit basis, not-for-profit basis. Can you explain to me kind of what that in reality actually means?
Yes, good question, guys. So we're currently working through our cost structure. We think we've got a good handle on that. It really is going to be dependent on the demand that comes through. So we've got a firm agreement in place with BARDA here in the U.S., but we're also working with the European Union, the Gates Foundation, other major countries to determine what that not-for-profit price will be. As you can imagine, the denominator is the units that go into that cost will be a big driver of that. But we think it'll be very competitive. It's, again, not-for-profit, and we've got so much transparency around that we are willing to have that audited by one of the major accounting firms to make sure that people fully understand what not-for-profit means in this case.
Well, and you kind of just mentioned it, sort of what the input costs are going to be, and I'm wondering, kind of, as you're moving forward with the vaccine and thinking about scaling up, what are you missing? What's going to cost you the most money? What are the sources or stuff that you need the most of?
So it really is, I'd say, almost 50-50 split in terms of the development cost, the scientific cost to do the research, as well as then the additional manufacturing capacity. We have a great facility in Leiden, Netherlands, that has a few bioreactors. We've complemented that capacity with contract manufacturers here in the U.S. that we're very excited about. Really good partnerships, off to a good start there. And so it will be dependent upon the demand that not only the U.S., but many other countries across the globe tell us that they're going to need in terms of vaccinations.
Joe, there are some that want to go about this in an underhand way. There's been a big story that has broken this afternoon. The UK authorities have accused Russia of trying to steal details on vaccines from key companies, potentially such as yours. Have you had any problems? Have you had any issues with security around your vaccine development program?
So, Guy, the news is just breaking, as you mentioned. I'll speak more generally as opposed to having a statement about any particular incident. But we take cybersecurity very serious, have for a number of years. It's on the forefront of not just the management team's mind here, but also our board of directors, and we provide them regular reviews.
But I think to put off of that, and I think what a natural segue is, Joe, is that everyone wants this vaccine. They want it now, yes. They want it fast. And we see sort of different governments tying up with different pharmaceutical companies. And it raises the question on who gets the vaccine first. Like, if you wind up making an agreement with someone in the European Union versus the U.S. or vice versa, like, how do you protect who you give it to?
Yeah, so we're working through that, Alex, right now to produce as many vaccines as possible. You probably heard Paul Staffel's talk today on our earnings call specifically that we should be in a position to have hundreds of millions of vaccines throughout the early part of next year with the goal of achieving 1 billion vaccines. So our abilities, in addition to those of some of our competitors, we think positions the overall, I'll say, global marketplace in pretty good position. And the fact that we've got many shots on goal bodes very well for both the industry and society.
Joe, you also make medical equipment, and that medical equipment is used in elective surgeries. Many of those elective surgeries have been cancelled, and we're watching what is happening in the Sun Belt in the United States. How is the kind of the uncertainty in regions like Florida and Texas buffeting your business? How much visibility do you have?
We've got really good visibility, so we're relying on the IHME model, but also we've complemented what was really our sole source at the end of March and early April to information from UCLA, MIT, and other prestigious institutions. I think probably the most valuable input we get, Guy, is when we talk to our customers. So Alex Gorski, Ashley McAvoy, and our medical device leadership team are speaking with hospital administrators, understanding how they're seeing so-called surges, how they're managing it, and then most importantly, what we can do as Johnson & Johnson to help. So we've got a lot of input, and I think we've got pretty good insight as to where the future may reside. Now, in the second quarter, we saw about a 30 to 35% decline in elective procedures year on year. We anticipated that was going to be closer to 40 to 60%. So as economies opened, that was good for healthcare systems.
Well, as economies reopen, you really have a nice window seat for that. Is the worst over?
So, Alex, in our guidance this morning, we made the statement, much like we did in April, that we believed that the second quarter was going to be the worst quarter that we would experience. We still have that same assumption today. If you just think about where we were at the end of March and early April and where we are today, society, healthcare systems are much better equipped. We have 700,000 tests daily in the U.S. alone. Treatment paradigms are much better in the hospitals. The percentage of somebody surviving COVID-19 after they've been intubated on a ventilator has dropped from 70% to 20% with respect to death. There's not massive discussion about outages for medical supplies. So I think we're in a much better position. And then you take on the economic factors. When we have isolation, it happens with more precision, and therefore we won't see the universal shutdowns that you might otherwise experience. We think that's critically important as a healthcare company because there is unintended consequences to deferring procedures too long, to deferring treatments. We know that's bad for patients' long-term health, as well as the cost to healthcare systems overall.